Hello and welcome back to the MCAT Psych Soch Made Easy series. Today we are talking all about depressive disorders. This one should be nice, easy, and straightforward. What's the difference between someone just feeling sad versus having clinical depression? I'm sure some of us, if not all of us, have experienced sadness throughout our life, whether something bad happened and we felt sad for a little bit, but it is important to be able to differentiate what that feels versus having true clinically diagnosed depression. So let's kick it off with a little question, get your brains thinking, and then we'll cover the content. Practice question number 1. A patient presents with recurrent depressive symptoms that occur exclusively during winter months. He reports hypersomnia, which means sleeping a lot more than usual, increased appetite, weight gain. Which of the following treatments is most specific and directly targets the proposed biological basis of his symptoms? So just think about it. Try to take a guess. SSRIs, or also known as selective serotonin reuptake inhibitors, bright light therapy, cognitive behavioral therapy, or benzodiazepines. If you don't know, that's totally okay. We're going to talk about it. So let's just get into the content. Now let's kick it off with what is depression. A depressive disorder must meet specific symptoms and time duration criteria. That means you need to have a certain amount of symptoms and it must last for a certain amount of time. And it's more than just feeling down. Like I said, we've all had maybe a death in the family or a loss of a relationship or something go wrong where we all feel down. But clinical depression is persistent, it's impairing, it's measurable, and it causes true dysfunction in someone's life. So the core concept is, in order to be diagnosed with major depressive disorder, you must have at least one major depressive episode in your life. It must last 2 or more weeks with 5 or more symptoms. We'll talk about the symptoms, but these symptoms must include at least depressed mood or anhedonia. And if you don't know what anhedonia means, it simply means the inability to feel pleasure or joy. So for example, maybe I used to really enjoy playing video games, but playing video games now no longer brings me joy. That's anhedonia. It doesn't give me any pleasure anymore. And the whole concept here is that in order to have this clinical diagnosis, all of these symptoms must cause significant distress or impairment of function in someone's life. So when we talk about the symptoms, there is a mnemonic that everyone uses in pre-med and med school. It is called SIG E CAPS. So it stands for, if you go down the line here, SIG E CAPS. So in order to have major depressive disorder, you must exhibit at least 5 of these symptoms. So sleep. This can mean that you are really having to sleep a lot more than usual. So I like to think of a panda. Pandas can kind of exhibit what the symptoms are. So they sleep a lot more, for example. They are not really interested in doing much, or they don't derive any pleasure from things that they do, like enjoying Netflix and watching TV. They feel guilty or worthless. Maybe they feel like a burden to their family. They feel like really low self-esteem. They will also have a very low energy, just laying around, not able to get out of bed. They will have low concentration, not able to focus or really do anything in terms of work or school. Their appetite may be either really high or really low. It could go either way, but a disturbance in appetite that leads to weight change is often a symptom that we see in patients that are depressed. And then psychomotor, what this means is, oftentimes we are either super restless or agitated, or on the other hand, it's like very hard to get out of bed. Our body feels sluggish. It feels like we weigh super heavy and our movement is extremely slow. So that just means our movement, our psychomotor abilities. Are they increased? Are they decreased? And then lastly, having suicidal thoughts, things like not wanting to wake up, not wanting to be present, having a specific plan or a specific intent with which someone may want to take their life. So these are the symptoms that someone may exhibit with major depressive disorder. Just remember SIG E CAPS to help you remember all of the different symptoms. Now, the next disorder we talk about is persistent depressive disorder, also known as dysthymia. This is similar to major depression, but a little different. It means that you have a chronically depressed mood that lasts for 2 or more years. Remember, in major depressive disorder, you typically have these episodes that last 2 or more weeks, whereas here we're lasting 2 or more years. You aren't experiencing as severe symptoms to meet the full major depressive disorder criteria, but it is persistent, right? You're chronically experiencing some of these symptoms for 2 or more years. And you can overlap these two things, right? Someone might persistently be depressed for 2 or more years and all of a sudden dip down into a major depressive episode. So these can coexist and you can have double depression in this case. Now, the next disorder we talk about is seasonal affective disorder. This is not a separate diagnosis. It can fall under MDD, and it is characterized basically as MDD with seasonal onset. So you have symptoms of major depression that are present only during the winter months, and we treat this with bright light therapy. As you can see here, someone being exposed to bright light on the inside, or if it's like really dark outside in winter months, like countries I think of like the Scandinavian countries or Poland, where I used to live at one point in time, where it would get super pitch black and dark outside by noon. So you can use bright light therapy to help with some of these symptoms, and we'll dig into how that works a little bit. So again, these symptoms are present in the winter months. It's kind of dark, muggy, groggy. I'm sure that at one point or another you've experienced this if you live in a place with seasons that has snowy times and darker times. But fun fact here is that this is really related to melatonin regulation. And if you remember, melatonin is the thing that kind of regulates our circadian rhythm. When we go to bed and it gets darker, melatonin gets released to help us go to sleep. So due to prolonged darkness in the winter, excessive melatonin production, right? Because it's not just dark at night, it's also maybe darker during the day. Our brain is releasing more melatonin and it's telling us to like be tired to get ready to go to sleep, but you don't really want to be experiencing that at noon. So that increased melatonin then leads to hypothetically increased fatigue and increased depression and these depressive symptoms. So here's a quick cheat sheet to compare the MDD versus PDD versus SAD, and you can use this as your reference later. But remember some of the distinguishing features. MDD is 2 or more weeks, PDD is 2 or more years, and SAD is a seasonal pattern, particularly during the winters. In terms of symptoms, you have to have 5 or more for MDD, and for PDD, it can be, not the full 5, but definitely 2 or more. And you will also experience some functional decline. And in SAD, you will also have things like sleeping a lot, eating a lot, gaining weight, some of those also depressive symptoms. And in terms of treatment, we definitely treat major depressive disorder with medications we call antidepressants, which are SSRIs, or CBT, which is cognitive behavioral therapy. We can also treat PDD with that same thing. And as we talked about, SAD can be treated with bright light therapy to help kind of reduce the amount of melatonin we're producing, because the light suppresses our melatonin production and tells us, hey, it's not time to go to sleep yet. It's not time to get tired. It's not time to have those symptoms or experience that depression. So you can come back to this cheat sheet anytime. And with that, let's revisit our question that we kicked it off with. Hopefully now you know the answer. Of a patient that has recurrent depressive symptoms exclusively during the winter, experiencing all of these symptoms. Which treatment is most specific and directly targets the proposed biological basis of these symptoms? Is it A, SSRIs, B, bright light therapy, C, cognitive behavioral therapy, or D, benzodiazepines, which are things like Ativan or Xanax, which you may have heard of, and we talked about this. So the answer with the seasonal affective disorder is being able to provide light so that we suppress melatonin release, and that is the biological basis there. Right, this is due to melatonin dysregulation due to that lack of sunlight exposure during the winter months. And so with that bright light therapy, we stimulate the biological mechanism to simulate sunlight and help regulate the circadian rhythm. Practice question number 2. A 27-year-old woman reports feeling down most days for the past 3 years. She denies any periods of elevated or super happy mood and meets 2 of the SIG E CAPS criteria. She states her symptoms never completely resolve but are always just there. Which of the following is the most likely diagnosis? Is it major depressive disorder, which we talked about, bipolar 2 disorder, which we haven't mentioned yet, persistent depressive disorder, or seasonal affective disorder? And the answer here is going to be C, persistent depressive disorder. Remember, major depressive disorder only lasts about 2 or more weeks, and you have to meet 5 of the SIG CAPS symptoms. Bipolar disorder, we haven't talked about yet, but stay tuned for our next episode. Remember that seasonal affective happens during the winter months, but for this person, it's just always there. So they are most likely to have persistent depressive disorder where they are down most days for the past 3 years. Remember, the criteria here is for 2 or more years. Good work so far. Key takeaways here. Know your SIG E CAPS criteria cold for the MCAT. Know the difference between MDD, PDD based on the symptoms and the duration. And remember that seasonal affective disorder is a subtype of MDD, but not a standalone diagnosis. As always, don't forget to follow and subscribe. If you found this video helpful, hit that like button. We really appreciate you. Stay tuned for more episodes coming up. And thanks for following Premed Academy. We focus on community, education, and coaching, and you can check us out in the link below.